Imagine for a moment that you wake up tomorrow with a splitting headache. You reach for some aspirin, swallow it with clean water, and within an hour, the pain fades away. Simple, right? Now imagine instead that your doctor hands you a vial of warm urine mixed with crushed beetles and tells you to drink it while Mercury aligns with Jupiter. Welcome to medieval medicine, where the cure was often worse than the disease. Before we dive into this journey through medical history's darkest chapter, I want to know, where are you listening to this story right now? Are you in your car? At home? Maybe taking a walk? And if you're finding this exploration as fascinating as I am, make sure to subscribe, because we're about to uncover truths about medieval medicine that will make you grateful for every modern pill you've ever taken. For nearly 1,000 years, from roughly 500 to 1500 AD, European medicine operated under principles that were not just wrong, they were catastrophically, lethally wrong. Yet these weren't the practices of ignorant savages. These were learned men and women, following sophisticated theories passed down through generations, theories that killed more patients than they saved. Today, we'll explore a world where doctors tasted their patients' urine to make diagnoses, where being bled 40 times a year was considered healthy maintenance, and where the most respected medical treatments involved substances so revolting that modern physicians would recoil in horror. This isn't a tale of barbarism, it's far more disturbing than that. It's the story of intelligent people, acting with the best intentions, trapped within a system of knowledge that was fundamentally, terrifyingly flawed. We'll meet the barber surgeons who performed amputations without anesthesia, the university-trained physicians who prescribed mixtures of human excrement and animal bile, and the church authorities whose religious convictions helped create one of medicine's most dangerous periods. We'll discover why a simple toothache could become a death sentence, how pregnancy became a game of Russian roulette, and why the Black Death exposed medieval medicine's complete helplessness in the face of genuine crisis. The numbers alone are staggering. In medieval Europe, 1 child in 4 died before their first birthday. 1 in 2 never reached the age of 10. Women faced a 9% chance of dying in childbirth, a mortality rate that would be considered catastrophic by today's standards. During plague years, entire communities watched 40 to 50% of their population simply vanish, while their most educated healers prescribed treatments that accelerated rather than prevented death. But perhaps the most chilling aspect of medieval medicine wasn't its failure to cure disease, it was how confidently, how systematically, it made sick people sicker. This was medicine elevated to an art form, complete with elaborate theories, expensive equipment, and centuries of scholarly tradition. It was medicine that killed with precision, all while maintaining the absolute conviction that it was saving lives. As we embark on this exploration, remember that we're not simply mocking the past. We're examining a cautionary tale about what happens when good intentions meet bad information, when authority replaces evidence, and when tradition becomes more powerful than truth. The physicians we'll encounter weren't monsters, they were the victims of their own expertise, prisoners of a system that rewarded confidence over curiosity. So take a deep breath of clean air, appreciate the antiseptic smell of modern medicine, and prepare yourself for a journey into a world where healing hands more often brought harm, where the most dangerous person in any medieval community might well have been the doctor himself. In the shadow of medieval Europe's great cathedrals, a peculiar class of individuals wielded power over life and death, with tools that would make modern surgeons weep. These were the healers of the Middle Ages, and understanding who they were reveals the first layer of medieval medicine's terrifying reality. Picture this. The year is 1200, and you've fallen gravely ill in Paris. Your family, desperate to save you, seeks out the most qualified medical expert they can find. They locate a learned man, draped in flowing robes, carrying an ornate staff, and speaking in Latin phrases that sound impressively scholarly. This man has studied at the finest universities, memorized the works of ancient masters, and commands respect throughout the city. He examines your urine in a special flask, consults his astrological charts, and prescribes a treatment based on centuries of accumulated wisdom. There's just one problem. This highly educated, supremely confident physician has never dissected a human body, never observed bacteria under a microscope, never understood how blood actually circulates through the human form. His entire medical education was based on texts written by ancient Greeks and Romans, filtered through Arabic translations, then retranslated into Latin, each step introducing new errors and misinterpretations. The medieval medical hierarchy was as rigid as it was dangerous. At the top sat the university-trained physicians, almost exclusively men who had taken religious vows. These medicus held the theoretical knowledge they could recite Galen's theories on the four humors, quote, Hippocrates on the nature of disease, and debate the finer points of astrological influence on human health. But they rarely, if ever, touched their patients directly. Beneath them labored the surgeons, initially monks who had been assigned the more practical aspects of healing. However, everything changed in 1163 when the Church issued a decree that would reshape medicine for centuries. Ecclesia abhorret a sanguine, the Church abhors blood. This single pronouncement meant that clergy could no longer perform surgery, could no longer shed blood in the course of treatment, could no longer engage in the messy, hands-on work of actually healing bodies. The result was medical chaos. The most educated healers were forbidden from performing the procedures that might actually help patients, while the right to cut into human flesh fell to whoever was willing and available. Enter the barber surgeons, men whose primary qualification was their skill with sharp implements. These were the same individuals who shaved beards and cut hair, now suddenly responsible for amputating limbs, removing tumors, and performing the crude surgical procedures that medieval life demanded. Imagine the terror of realizing that your brain surgery would be performed by the same man who had trimmed your neighbor's mustache that morning. The barber surgeons did their best with the knowledge available, but they were craftsmen suddenly elevated to the status of life-or-death decision-makers, armed with nothing but sharp tools and dangerous confidence. Below even the barber surgeons existed an entire underground economy of healers, the tooth pullers who worked at market fairs, the wandering charlatans who sold miracle cures from the backs of wagons, the village wise women whose remedies might involve anything from herbs to incantations to substances too revolting to mention in polite company. But the truly educated physicians, the university graduates who commanded the highest fees and greatest respect, operated under medical theories that were not merely outdated, they were actively harmful. The cornerstone of their practice was the theory of the four humors: blood, phlegm, yellow bile, and black bile. According to this system, illness resulted from an imbalance among these bodily fluids, and treatment involved restoring proper equilibrium through various means of adding or subtracting these humors. This theory, elegant in its simplicity, had one fatal flaw. It was completely wrong. The human body doesn't operate according to four mystical fluids that need balancing. But medieval physicians didn't know this, and their ignorance had lethal consequences. A patient suffering from what we now know was a bacterial infection would be subjected to bloodletting to reduce excess blood, purging to eliminate corrupt bile, or the application of substances intended to draw out poisonous humors through the skin. The confidence with which these treatments were administered makes them even more disturbing. Medieval medical texts don't hedge their bets or express uncertainty. They provide detailed, specific instructions for treatments that modern science recognizes as torture. A physician treating melancholia, what we might now call depression, would confidently prescribe bloodletting, purging with violent laxatives, and the consumption of herbs that we now know are toxic to the human nervous system. Even more troubling was the integration of astrology into medical practice. Physicians didn't simply guess at treatments. They consulted elaborate star charts to determine the optimal timing for bloodletting, the proper herbs to prescribe based on planetary alignments, and the cosmic influences affecting their patients' conditions. This wasn't superstition, it was considered the height of medical sophistication. The University of Paris, Bologna, and other centers of learning produced graduates who could discourse brilliantly on the influence of Saturn on bilious disorders, who could recite lengthy passages about the relationship between lunar phases and feminine ailments, who could construct complex charts linking zodiacal signs to different organs of the body. These men were the medical elite, the most expensive and sought-after healers of their time, and they were killing their patients with scholarly precision. The tragedy of medieval medicine wasn't ignorance, it was miseducation. A completely untrained person might occasionally stumble upon effective treatments through trial and error. But the university-trained physicians were armed with centuries of accumulated wrong information, presented with such authority and internal consistency that questioning it seemed absurd. Consider the case of Guy de Chauliac, one of the most celebrated surgeons of the 14th century. Grande Chirurgie was considered the definitive surgical textbook for over 2 centuries. De Chauliac was brilliant, dedicated, and eager to help his patients. He was also completely wrong about human anatomy, utterly mistaken about the causes of disease, and absolutely convinced that his treatments were based on unshakable scientific principles. When the Black Death struck Europe in 1348, killing perhaps half the population in some regions, de Chauliac and his colleagues responded with their full arsenal of medical knowledge. They prescribed bloodletting to balance the humors disrupted by plague, recommended purging to eliminate corrupt matter from the body, and suggested complex herbal mixtures designed to restore the proper relationship between hot and cold, moist and dry elements in their patients' constitutions. The result was that those wealthy enough to afford the best medical care often died faster than those who couldn't afford treatment at all. But the medical establishment of medieval Europe had one more terrifying characteristic. It was completely closed to new information. The theoretical framework was considered complete and perfect. Ancient authorities like Galen and Avicenna had supposedly solved all the fundamental questions about health and disease. The job of medieval physicians wasn't to discover new truths, but to apply established truths more skillfully. This meant that when treatments failed, the failure was attributed to poor application rather than flawed theory. When patients died despite receiving the most advanced medical care available, their deaths were explained as resulting from complications beyond medical control, not as evidence that the medical theories themselves might be wrong. The few voices that suggested alternative approaches were quickly silenced. Dissection of human bodies was either forbidden or severely restricted, not because the Church opposed anatomical knowledge, but because the existing texts were considered so complete that actual observation seemed unnecessary. When physicians occasionally did examine corpses, they saw what the ancient texts told them they should see, rather than what was actually before their eyes. This was medicine by authority, rather than observation, healing by tradition, rather than experiment, treatment based on what should work according to theory, rather than what actually did work in practice. It was a system designed to perpetuate itself regardless of its effectiveness, a medical establishment that measured success by its adherence to established principles rather than by its ability to save lives. The healers of medieval Europe weren't evil men seeking to harm their patients. They were, in many ways, the victims of their own education, trapped within a system of knowledge that was both impressively sophisticated and lethally wrong. They had memorized vast amounts of information, mastered complex theoretical frameworks, and devoted their lives to the practice of healing. They just happened to be healing people to death. In the long catalogue of medieval medicine's lethal practices, none was more systematically destructive than bloodletting, the deliberate removal of blood from patients as a treatment for virtually every ailment known to medicine. This wasn't occasional therapy reserved for specific conditions. It was the universal remedy, applied with scientific precision and scholarly confidence to patients ranging from crying infants to dying plague victims. To understand the scope of medieval bloodletting, consider this. A typical wealthy patient in 13th century Europe would be bled between 20 and 40 times per year. Not in emergencies, not for serious conditions, but as routine preventive medicine, like a modern person taking vitamins. Medieval physicians viewed regular bloodletting as essential health maintenance, as natural and necessary as eating or sleeping. The theoretical foundation for this practice rested on the four-humor system that dominated medieval medical thought. According to this theory, blood was just one of four vital fluids that needed to be maintained in perfect balance for optimal health. Too much blood would create a sanguine temperament, characterized by excessive energy, aggression, and passion. Too little blood would leave patients weak and melancholic. The physician's job was to achieve the perfect balance by regularly draining excess blood from their patients' bodies. Medieval medical texts provided elaborate charts showing exactly how much blood should be removed based on the patient's age, gender, astrological sign, and the season of the year. Spring bloodletting required different volumes than autumn procedures. Men needed more blood removed than women. Children required proportionally smaller amounts drained, but they still received regular bloodletting from infancy onward. The precision with which medieval physicians approached bloodletting makes the practice even more disturbing. They didn't simply cut patients and hope for the best. They calculated exact amounts of blood to remove, measured in specific units, timed according to lunar phases and planetary alignments. A typical prescription might call for removing 12 ounces of blood from the patient's left arm during the waxing moon, followed by 8 ounces from the right arm 3 days later, if Jupiter was properly positioned relative to Mars. The tools of bloodletting were as varied as they were terrifying. The phleem, a sharp blade attached to a handle, was used to make precise cuts in veins. The scarificator, a device equipped with multiple spring-loaded blades, could create dozens of small cuts simultaneously. Cupping glasses, heated and applied to scarified skin, would draw blood through suction. And then there were the leeches, medicinal leeches, specifically bred and maintained for blood removal. Leech therapy represented the apex of medieval bloodletting sophistication. Physicians maintained detailed knowledge about different species of leeches, their blood consumption rates, and their suitability for different types of patients. The medicinal leech, Hirudo medicinalis, was preferred for its predictable feeding habits and the volume of blood it could consume. Specialists, known as leech dealers, supplied physicians with fresh, healthy leeches, and proper leech storage and maintenance were considered essential medical skills. A single leech could consume up to 5 times its body weight in blood, and medieval physicians would routinely apply dozens of leeches to individual patients. The creatures would be placed on specific parts of the body according to elaborate theories about blood flow and organ systems. Leeches applied to the temples were thought to relieve headaches, by reducing blood pressure in the brain. Leeches placed on the abdomen would supposedly cure digestive problems by removing excess blood from the stomach and liver. But perhaps the most disturbing aspect of medieval bloodletting was its application to patients who were already critically ill. When someone was dying from blood loss due to injury or internal bleeding, medieval physicians would often prescribe additional bloodletting to balance the humors disrupted by the patient's condition. Surgical patients who had lost substantial blood during operations would be bled further to prevent the development of corrupt humors that supposedly formed when blood levels became imbalanced. Pregnant women represented a special category for bloodletting practitioners. Medieval medical theory held that pregnancy created dangerous imbalances in feminine humors that required regular correction through blood removal. Pregnant patients were routinely bled throughout their pregnancies, often multiple times per month, based on theories that excess blood during pregnancy would harm both mother and child. The practice became even more deadly during childbirth. Women experiencing difficult labor were often subjected to vigorous bloodletting, based on the theory that excess blood was preventing proper delivery. Mothers suffering from postpartum complications were bled to remove corrupt blood that supposedly caused their problems. The combination of natural blood loss during childbirth plus deliberate medical bloodletting created a lethal double assault that contributed significantly to medieval Europe's catastrophic maternal mortality rates. Children weren't spared from bloodletting, although the quantities were adjusted for their smaller size. Medieval physicians had detailed protocols for bleeding infants, toddlers, and adolescents, based on theories about how the four humors developed and changed throughout childhood. A feverish child would be bled to reduce excess hot blood. A listless child would be bled to eliminate corrupted cold blood that was supposedly suppressing their natural energy. The elderly received special attention from bloodletting practitioners, who believed that old age caused blood to become thick and sluggish, requiring regular draining to maintain health. Elderly patients were often bled monthly or even weekly, based on theories that failing circulation in aging bodies allowed blood to stagnate and become poisonous. The practice of bleeding already weakened elderly patients undoubtedly hastened many deaths that were then attributed to natural aging rather than medical intervention. Medieval bloodletting also incorporated elaborate timing rituals based on astrological calculations. Physicians consulted complex charts linking planetary positions to optimal bloodletting schedules. The phase of the moon was crucial. Bloodletting during a waxing moon was thought to be more effective than procedures performed during a waning moon. The season of the year mattered, as did the day of the week and even the time of day. These timing considerations weren't casual preferences. They were considered essential medical science. A physician who performed bloodletting at the wrong astrological moment was thought to be risking the patient's life through improper treatment. Medical schools taught elaborate courses on astrological timing for bloodletting, and the most prestigious physicians were often those who had mastered the complex calculations required to schedule bloodletting procedures for maximum therapeutic benefit. The locations on the body where blood was drawn were also determined by sophisticated theoretical systems. Medieval anatomy divided the body into zones supposedly governed by different planets and astrological signs. Blood drawn from the left arm was thought to affect different organ systems than blood drawn from the right arm. Bleeding from the forehead would influence brain function differently than bleeding from the ankle. Physicians maintained detailed charts showing hundreds of different bloodletting points on the human body, each supposedly connected to specific organs and medical conditions. A patient suffering from liver problems would be bled from points associated with liver function. Heart conditions required bloodletting from cardiovascular points. Mental illness was treated by bleeding from cranial points thought to be connected to brain function. The volume of blood removed during individual procedures was staggering by modern standards. A typical bloodletting session might remove 2 to 4 pints of blood from an adult patient, enough to cause serious weakness in a healthy person and potentially fatal blood loss in someone already ill. Medieval physicians had no understanding of blood volume, circulation, or the body's mechanisms for replacing lost blood, so they had no framework for recognizing when bloodletting was causing more harm than good. The practice was so ingrained in medieval medical culture that questioning bloodletting was considered evidence of medical ignorance. Physicians who suggested that removing large quantities of blood might weaken patients were dismissed as poorly educated. The theoretical framework supporting bloodletting was so elaborate and internally consistent that doubting its effectiveness seemed to require doubting the entire foundation of medical science. This created a deadly feedback loop where failed treatments led to more aggressive interventions rather than reconsideration of basic assumptions. When patients didn't improve after bloodletting, physicians concluded that insufficient blood had been removed and ordered more aggressive procedures. When patients became weaker after blood removal, this was interpreted as evidence that their blood had been more corrupted than initially suspected, requiring additional bloodletting to complete the cure. The economic incentives surrounding bloodletting made the practice even more dangerous. Bloodletting was a relatively simple procedure that could be performed quickly and repeatedly, making it highly profitable for medical practitioners. A physician could bleed multiple patients in a single day, generating substantial income from each procedure. The demand for regular bloodletting as preventive medicine created steady revenue streams that encouraged practitioners to recommend the procedure as frequently as possible. Bloodletting also became a mark of social status. Wealthy patients expected their physicians to provide sophisticated bloodletting treatments, complete with the finest leeches, the most elegant instruments, and the most complex astrological calculations. Poor patients who couldn't afford regular bloodletting were often considered to be missing essential medical care. The practice became not just a medical treatment, but a symbol of access to the best health care available. The persistence of bloodletting throughout the medieval period, despite its obvious harmful effects, illustrates the power of theoretical authority over practical observation. Medieval physicians could see that their bloodletting patients often became weaker, sicker, and more likely to die, but they interpreted these observations through the lens of humoral theory rather than recognizing them as evidence that the treatment itself was harmful. It would take centuries for the medical establishment to recognize that deliberately weakening sick patients by removing their blood was counterproductive. Even then, bloodletting persisted well into the modern era, finally disappearing only when the development of scientific medicine provided better explanations for disease and more effective treatments. The legacy of medieval bloodletting serves as a powerful reminder of how dangerous medicine can become when theoretical sophistication replaces practical observation, when professional authority substitutes for scientific evidence, and when the confidence of practitioners matters more than the survival of patients. In the annals of medical history, no era produced remedies quite as revolting, toxic, or bizarre as medieval Europe's pharmacopoeia. While modern patients might complain about the taste of liquid medicine, medieval patients faced treatments that would challenge the strongest stomach and the most desperate constitution. These weren't the folk remedies of ignorant peasants. These were sophisticated pharmaceutical preparations, carefully documented in university medical texts and prescribed by the most educated physicians of the time. The theoretical foundation for medieval medicine's nauseating remedies rested on the principle of sympathetic magic combined with humoral theory. According to this system, diseases caused by corrupt humors required treatments using substances that were equally corrupt to draw out the infection. Poison would attract poison. Filth would extract filth. and the most repugnant substances would be most effective against the most serious ailments. This led to pharmaceutical preparations that defy modern comprehension. Consider the standard treatment for epilepsy, known in medieval times as the falling sickness. Physicians prescribed a mixture of dried human skull, ground pearls, and the blood of a freshly beheaded criminal, combined with powdered unicorn horn if the patient could afford such exotic ingredients. The preparation was administered during the full moon while reciting specific Latin incantations. Based on theories that epilepsy resulted from demonic possession that could only be countered by substances connected to death and purity. Urinary tract infections were treated with what medieval texts called sovereign remedies that included drinking fresh human urine, preferably from a virgin boy under the age of 12. The logic was impeccable according to medieval medical theory. Since the disease affected urine production, the cure must involve consuming pure urine to restore proper function. Physicians had elaborate protocols for collecting this medicinal urine, including dietary restrictions for the donor and timing requirements based on astrological considerations. For patients suffering from what we now know were mental illnesses, medieval pharmacology offered particularly disturbing remedies. Depression, or melancholia, was treated with preparations that included human excrement, bat blood, and powdered dove hearts. The excrement had to come from healthy young men who had consumed specific diets designed to produce therapeutically valuable waste. The bat blood was collected during new moons, and the dove hearts were removed while the birds were still alive, based on theories that fear and pain enhanced the medicinal properties of animal organs. Perhaps the most extensive category of revolting medieval remedies involved treatments derived from human and animal waste products. These weren't desperate last resorts. They were mainstream therapeutic options prescribed by university-trained physicians and documented in the most respected medical texts of the period. The 15th century medical compilation, recently digitized by Cambridge University, reveals over 80 recipes, many featuring substances that modern medicine would classify as biohazardous waste. Gastrointestinal problems were commonly treated with preparations called album graecum, a medicinal substance made from the dried excrement of dogs that had been fed nothing but bones for several days. The preparation process was elaborate. The dog waste was collected, dried in the sun, ground into powder, and mixed with wine and honey to create a paste that patients consumed 3 times daily. The theoretical basis was that dogs possessed naturally strong digestive systems, so their processed waste would strengthen human digestion. For respiratory ailments, medieval physicians prescribed inhalation therapies that included burning mixtures of human hair, dried animal organs, and various forms of concentrated urine. Patients with consumption, what we now call tuberculosis, were instructed to breathe smoke created by burning the lungs of freshly slaughtered foxes, mixed with powdered human placenta and dried bat wings. The logic was that healthy animal lungs would strengthen diseased human lungs through sympathetic connection. Skin conditions received particularly creative pharmaceutical attention. Patients suffering from what medieval texts called leprous affections, probably various forms of dermatitis or bacterial skin infections, were treated with ointments made from rendered human fat, ideally obtained from executed criminals. The fat was mixed with powdered lizard skin, ground beetle shells, and various plant extracts to create salves that were applied daily while reciting prayers to Saint Lazarus, the patron saint of skin diseases. The medieval pharmaceutical arsenal included an extensive collection of remedies based on animal testicles, each supposedly suited to specific medical conditions. Beaver testicles were prescribed for nervous disorders, based on the theory that beavers were naturally anxious animals whose reproductive organs would calm human anxiety. Wolf testicles were used to treat cowardice and lack of masculine vigor. Rabbit testicles were recommended for fertility problems, based on observations of rabbit reproductive success. These testicular preparations weren't simple folk remedies. They were sophisticated pharmaceutical products with detailed preparation instructions. The testicles had to be harvested at specific times, often during particular seasons or lunar phases, then preserved using complex processes involving salt, wine, and various herbs. The finished products were ground into powders, formed into pills, or dissolved in liquids for internal consumption. Medieval medicine's approach to pediatric pharmaceuticals was particularly disturbing. Children suffering from common childhood diseases were given remedies that included ground human teeth, dried animal blood, and preparations made from the urine of pregnant women. The theory held that children required more potent medicines because their small bodies needed concentrated doses of healing substances to achieve therapeutic effects. Teething infants were given necklaces made from wolf teeth or dried human tongues, based on beliefs that the hardness of these materials would strengthen developing teeth. Colicky babies were fed mixtures that included powdered mouse droppings dissolved in wine, administered through feeding horns made from animal bones. The mortality rate among infants receiving these treatments was catastrophic, but medieval physicians attributed deaths to the severity of childhood diseases rather than to their pharmaceutical interventions. Women's health represented another area where medieval pharmacology achieved particular levels of revulsion and toxicity. Menstrual disorders were treated with preparations that included ground menstrual blood from other women, mixed with powdered iron and various herbs. The logic was that, like cures like menstrual problems required menstrual solutions. These preparations were often contaminated with dangerous bacteria and contributed significantly to the high rates of infection among medieval women. Pregnancy complications were addressed with remedies that modern medicine recognizes as actively harmful to both mother and child. Women experiencing difficult pregnancies were given mixtures containing mercury, lead, and various plant alkaloids that we now know cause birth defects and pregnancy loss. The theoretical basis was that pregnancy represented an imbalance of hot and cold humors that required correction through mineral supplements. The most expensive and sought-after medieval pharmaceuticals often combined multiple revolting ingredients into single preparations. Considered the ultimate cure, all remedy contained over 60 different components including viper flesh, opium, various animal organs, and multiple forms of processed waste. The preparation process took months and required the supervision of master physicians who charged enormous fees for authentic theriac. The production of theriac became a public spectacle in major medieval cities, with elaborate ceremonies surrounding the mixing and aging of ingredients. Venice became famous for its theriac production, with the city government guaranteeing the authenticity and potency of Venetian theriac. Patients would travel hundreds of miles to obtain genuine theriac, believing that cheaper imitations lacked the therapeutic power of properly prepared versions. Medieval pharmaceutical theory also embraced the concept of mummy medicine treatments derived from human corpses, particularly those that had been naturally or artificially preserved. Ground Egyptian mummy was considered especially valuable, leading to a thriving trade in authentic mummy powder. When Egyptian sources became scarce, European suppliers began producing artificial mummy by treating fresh corpses with bitumen and various preservatives, then aging them to achieve the proper medicinal characteristics. The use of mummy medicine wasn't limited to exotic imports. Medieval physicians routinely prescribed treatments derived from local corpses, particularly those of individuals who had died under specific circumstances. The skull of a person who had been struck by lightning was considered especially powerful for treating epilepsy. Blood from executed criminals was thought to cure various forms of madness. Moss that grew on the skulls of hanged men was harvested and used to treat wounds and infections. These human-derived pharmaceuticals created a macabre economy where grave robbing and corpse harvesting became profitable enterprises. Professional body snatchers supplied physicians with fresh human organs, blood, and other tissue for pharmaceutical preparation. Executioners sold access to freshly killed criminals, allowing physicians to harvest blood, organs, and other materials while they were still warm and presumably at peak medicinal potency. The persistence of these revolting remedies throughout the medieval period reveals the power of theoretical medicine over practical observation. Physicians could see that patients receiving ground skull preparations often died, that children given mouse droppings frequently developed severe digestive problems, that women treated with menstrual blood mixtures suffered from dangerous infections. But these observations were interpreted through the lens of humoral theory, rather than recognized as evidence that the treatments themselves were harmful. Medieval pharmaceutical texts provided detailed explanations for treatment failures that protected the theoretical framework while shifting blame to external factors. If a patient died after receiving theriac, the death was attributed to corrupted ingredients, improper preparation, or incorrect timing of administration. If ground mummy failed to cure epilepsy, the failure was blamed on using mummy that was too old, too young, or derived from the wrong type of corpse. This created a system where successful treatments were credited to correct application of pharmaceutical theory, while failures were attributed to practical errors in implementation. The theory itself remained beyond criticism, protected by centuries of scholarly authority and the professional interests of physicians who had built their careers around these practices. The economic incentives surrounding medieval pharmaceuticals made the system even more resistant to reform. The most expensive remedies often required exotic or difficult-to-obtain ingredients, creating substantial profits for physicians who could provide authentic preparations. Ground unicorn horn, genuine mummy powder, and fresh criminal blood commanded premium prices, making it financially advantageous for practitioners to recommend the most exotic and expensive treatments available. Wealthy patients expected their physicians to provide the finest pharmaceutical preparations, regardless of cost or effectiveness. A treatment made from common herbs was considered inferior to one containing rare animal organs and human-derived substances. The social status associated with receiving exotic pharmaceuticals created demand for increasingly elaborate and revolting remedies. The gradual decline of medieval pharmaceutical practices occurred slowly and against significant resistance from the established medical community. Even as more effective treatments became available, many physicians continued to prescribe traditional remedies based on humoral theory, arguing that ancient wisdom shouldn't be abandoned in favor of unproven innovations. The transformation of medieval pharmacology into modern pharmaceutical science required fundamental changes in medical thinking. Instead of treatments based on theoretical sympathies and humoral balancing, modern pharmacology focuses on chemical compounds with proven biological effects. Instead of substances chosen for their symbolic properties or theoretical connections to disease, modern medicines undergo rigorous testing to demonstrate safety and efficacy. Yet the legacy of medieval pharmaceutical practices serves as a sobering reminder of how sophisticated theoretical frameworks can lead to genuinely harmful medical interventions. The physicians who prescribed ground skull and fermented urine weren't malicious or ignorant. They were applying the best medical knowledge available to them, knowledge that happened to be fundamentally wrong about the nature of disease and the mechanism of healing. The revolting remedies of medieval medicine weren't aberrations or departures from proper medical practice. They were the logical conclusion of a medical system based on authority rather than evidence, tradition rather than observation, and theoretical elegance rather than practical effectiveness. When we think of medieval surgery, images of crude butchery and screaming patients often come to mind, but the reality was both more sophisticated and more terrifying than popular imagination suggests. Medieval surgery wasn't primitive because surgeons lacked skill. It was horrifying because they possessed just enough knowledge to be dangerous, combined with theories that were catastrophically wrong and tools that were designed more for carpentry than healing. The separation of surgery from medicine, mandated by the Church's 1163 decree against clergy shedding blood, created a medical caste system that doomed surgical patients to treatment by practitioners who lacked theoretical medical training. While university-educated physicians studied the four humors and consulted astrological charts, actual surgical work fell to barbers, who at least possessed steady hands and sharp instruments, even if they had no understanding of human anatomy, infection, or the basic principles of healing. Picture a typical surgical scenario in 13th century London. A carpenter has suffered a severe injury to his arm, and the local barber surgeon has determined that amputation is necessary. The patient is held down by several strong men while the barber surgeon sharpens his tools, essentially the same implements used for cutting hair and trimming beards. No anesthesia exists except perhaps a leather strap to bite on and a cup of strong wine to dull the pain. The surgical site receives no sterilization because the concept of germs won't be discovered for another 6 centuries. The amputation itself proceeds with brutal efficiency. The barber surgeon makes his cuts quickly, sawing through bone with tools that might have been used to cut wood earlier that morning. Bleeding is controlled through immediate cauterization with red-hot iron implements, filling the air with smoke and the smell of burning flesh. The patient, if he remains conscious, experiences agony that modern minds can barely comprehend. The entire procedure takes perhaps 10 minutes, after which the patient faces the real challenge, surviving the inevitable infection that follows. What makes medieval surgery particularly tragic is that some surgical procedures were genuinely necessary and could have been life-saving with proper technique and post-operative care. Battlefield injuries, traumatic accidents, and various medical conditions did require surgical intervention. Medieval surgeons often correctly identified problems that needed surgical solutions. Their failure lay not in diagnosis, but in execution and aftercare. Medieval surgical texts reveal a disturbing confidence in procedures that were essentially guaranteed to kill patients. The Grande Chirurgie of Guy de Chauliac, considered the authoritative surgical manual for over 2 centuries, provides detailed instructions for operations that no modern surgeon would attempt without extensive support systems. Brain surgery, abdominal operations, and complex reconstructive procedures were described with the same casual confidence that modern manuals might reserve for removing splinters. The tools of medieval surgery were adapted from other trades, rather than designed specifically for medical use. Surgical saws were often borrowed from carpenters. Cutting implements came from leatherworking or food preparation. Cauterization tools were usually repurposed metalworking equipment. This improvised toolkit, combined with complete ignorance of sterilization, meant that surgical instruments routinely introduced additional infections and complications into already compromised patients. Medieval surgery's approach to pain management was limited to physical restraint and alcohol consumption. Patients were typically held down by multiple assistants while conscious during the most traumatic procedures imaginable. Some surgical texts mention soporific sponges, cloth materials soaked in opium and various herbs, held over patients' faces during operations, but these provided minimal pain relief and often caused additional complications through respiratory depression. The concept of surgical anesthesia was so foreign to medieval medical thinking that pain during surgery was often considered therapeutically beneficial. According to humoral theory, the shock and trauma of surgical pain helped rebalance disrupted humors and promoted healing. Patients who remained conscious during operations were thought to have better outcomes than those who lost consciousness, leading surgeons to deliberately avoid any techniques that might reduce patient awareness during procedures. Postoperative care in medieval surgery was based on principles that actively promoted infection and delayed healing. Surgical wounds were typically packed with materials that we now know are highly contaminated: animal dung, rotting organic matter, and various substances chosen for their theoretical rather than practical healing properties. The goal was to promote laudable pus-infected drainage that medieval surgeons believed indicated proper healing. Medieval surgical theory held that wounds needed to remain open and draining to allow corrupt humors to escape from the body. Surgeons would insert foreign objects into healing wounds to prevent them from closing, believing that premature closure would trap infection inside the patient's body. This practice virtually guaranteed that surgical patients would develop severe infections that often proved fatal weeks or months after apparently successful operations. The mortality rates for medieval surgery were catastrophic by any standard. Simple procedures like tooth extraction carried significant risks of death from infection. More complex operations had survival rates that would be considered unacceptable even in modern emergency medicine. Yet surgical patients were often wealthy individuals who could afford the best medical care available, suggesting that surgical mortality wasn't simply a matter of poverty or neglect. Medieval surgery's approach to battlefield medicine reveals the gap between theoretical knowledge and practical effectiveness. Military surgeons developed sophisticated techniques for removing arrows, treating sword wounds, and managing traumatic injuries that were common in medieval warfare. Their procedures were often mechanically sound and demonstrated genuine understanding of anatomy and wound management. But their ignorance of infection control meant that soldiers who survived the initial trauma of battle often died from surgical complications weeks later. The economic incentives surrounding medieval surgery created additional dangers for patients. Surgical procedures were expensive and profitable, encouraging practitioners to recommend operations even when conservative treatment might have been more appropriate. A barber surgeon who could successfully perform complex operations commanded higher fees and greater respect than one who limited himself to simple procedures. This created pressure to attempt increasingly ambitious surgical interventions, often on patients who were too sick or injured to survive such procedures. Medieval surgical texts describe operations of staggering complexity performed on patients who modern medicine would recognize as unsuitable surgical candidates. The professional reputation that came from attempting dramatic surgical procedures often outweighed considerations of patient survival. Medieval surgical education, such as it was, emphasized theoretical knowledge over practical experience. Surgical students learned by reading texts and observing operations, rather than through gradual, supervised practice on less complex cases. A newly trained surgeon might attempt major operations with minimal hands-on experience, relying on textbook knowledge that was often centuries old and based on anatomical understanding that was frequently wrong. The few medieval surgeons who achieved genuine expertise often did so through military service, where the volume of traumatic injuries provided extensive practice in surgical techniques. These military surgeons developed skills that exceeded those of their civilian counterparts, but even the best medieval military surgery was limited by the same theoretical misconceptions and practical constraints that affected all medieval medicine. Women in medieval society faced particular surgical dangers because female anatomy was poorly understood even by the standards of medieval medicine. Obstetric surgery was often performed by male practitioners who had never observed normal childbirth. Relying on theoretical knowledge derived from ancient texts that contained significant errors about female reproductive anatomy. Cesarean sections were typically fatal, not because the surgical technique was impossible, but because post-operative care was based on principles that guaranteed lethal infection. The persistence of ineffective surgical practices throughout the medieval period illustrates the power of professional authority over practical results. Medieval surgeons could observe that their patients frequently died following operations, but they interpreted these deaths as resulting from the severity of the underlying conditions rather than from the surgical interventions themselves. Surgical complications were explained through the theoretical framework of humoral medicine rather than recognized as evidence that surgical techniques needed improvement. A patient who died from post-operative infection was said to have succumbed to corrupt humors rather than surgical contamination. A patient who never recovered from surgical trauma was thought to have been too weak to benefit from necessary medical intervention. This protected the theoretical foundations of medieval surgery from criticism while allowing practitioners to maintain confidence in their methods despite overwhelming evidence of their ineffectiveness. The result was a surgical practice that persisted for centuries without significant improvement, killing patients who might have survived without any medical intervention at all. The transformation of surgery from medieval butchery to modern medicine required not just better tools and techniques, but fundamental changes in medical thinking. The development of anesthesia, antiseptic technique, and evidence-based surgical practice created modern surgery that bears no resemblance to its medieval predecessor, except in the basic goal of treating disease through direct intervention. Yet the medieval surgical experience serves as a powerful reminder that good intentions, professional confidence, and theoretical sophistication cannot substitute for accurate knowledge and effective technique. The medieval surgeons who performed these horrifying procedures weren't sadistic butchers. They were skilled craftsmen working within a medical system that was fundamentally flawed at every level. Nothing exposed the complete failure of medieval medicine more devastatingly than the arrival of the Black Death in 1347. When the plague ships docked in European ports carrying their cargo of disease and death, they brought more than just pestilence. They brought the ultimate test of medieval medical theory and practice. The results would be a catastrophic demonstration of just how deadly sophisticated ignorance could become when confronted with genuine medical crisis. The Black Death killed between 1/3 and half of Europe's population in just 5 years, making it one of the most devastating pandemics in human history. But the true horror wasn't just the disease itself, it was the response of Europe's most educated medical professionals, who applied their full arsenal of theoretical knowledge and sophisticated treatments to create outcomes that were often worse than no treatment at all. When the plague first appeared in the Mediterranean, Europe's medical establishment responded with characteristic confidence. The University of Paris Faculty of Medicine, considered the most authoritative medical institution in Europe, produced an official report explaining the plague's causes and recommending treatments. Their analysis was a masterpiece of medieval medical thinking. They attributed the disease to a dangerous conjunction of Saturn, Jupiter, and Mars that had occurred in 1345, creating atmospheric conditions that corrupted the air and generated pestilential vapors. This astrological explanation led to treatment recommendations that were both elaborate and lethal. According to the Parisian medical faculty, plague resulted from corrupted air that disrupted the body's natural balance of humors. Treatment required purging these corrupt humors through vigorous bloodletting, violent purging with powerful laxatives, and the application of various substances designed to draw pestilential vapors out through the skin. The results were predictably catastrophic. Plague patients who received the most advanced medical treatment available often died more quickly than those who received no medical attention at all. The bloodletting that was supposed to purge corrupt humors instead weakened patients who were already fighting a serious infection. The purging that was meant to eliminate pestilential matter instead caused severe dehydration in patients whose bodies were already under assault from disease. Medieval physicians approached plague treatment with the same systematic confidence they brought to all medical conditions. They had detailed protocols for different stages of plague progression, specific bloodletting schedules based on patient age and astrological considerations, and elaborate pharmaceutical preparations designed to counteract pestilential corruption. What they didn't have was any understanding of infectious disease, bacterial pathology, or immune system function. The visual symptoms of plague, the notorious buboes that gave bubonic plague its name, received particular attention from medieval medical theorists. These swollen, painful lymph nodes were interpreted through the lens of humoral theory as evidence that the body was attempting to expel corrupt matter through the skin. Treatment involved encouraging this process through various forms of intervention that modern medicine recognizes as actively harmful. Medieval surgeons would lance buboes to release their contents, performing these procedures in completely unsterile conditions that guaranteed secondary bacterial infections. They applied caustic substances to buboes to promote drainage, often causing chemical burns that added to patient suffering. They used cupping and scarification to draw out supposed corruption, creating multiple wounds that became additional sites for infection. The pharmaceutical response to plague reveals medieval medicine at its most elaborate and ineffective. Plague patients received complex preparations that included multiple forms of processed waste, exotic animal products, and toxic substances that were thought to counteract pestilential corruption. These preparations were often more dangerous than the disease itself, adding poisoning to the list of challenges that plague patients faced. One popular plague remedy combined mercury, arsenic, and various plant alkaloids into a preparation that was supposed to purge pestilential humors through violent vomiting and diarrhea. Patients who survived this treatment often died from mercury poisoning rather than plague, though medieval physicians attributed such deaths to the severity of pestilential corruption rather than to their pharmaceutical interventions. The economic incentives surrounding plague treatment made the medical response even more destructive. Wealthy plague patients paid enormous fees for the most advanced treatments available, creating financial pressure for physicians to provide elaborate and expensive interventions rather than simple supportive care. The most costly treatments were often the most harmful, combining multiple dangerous procedures into comprehensive therapeutic programs that virtually guaranteed patient death. Medieval medical theory also led to public health responses that probably accelerated plague transmission rather than controlling it. Because plague was attributed to corrupted air, authorities focused on eliminating bad odors and generating good smells through the burning of aromatic substances. These efforts had no effect on plague transmission, but created gathering points where infected and healthy individuals came into close contact. The theory of pestilential vapors led to recommendations that people avoid bathing during plague outbreaks, based on beliefs that water opened skin pores and allowed corrupt air to enter the body more easily. This reduction in personal hygiene probably contributed to the spread of plague and other infectious diseases, creating additional public health crises on top of the plague pandemic itself. Medieval plague medicine also reveals the period's complete misunderstanding of contagion and disease transmission. While some physicians noticed that plague seemed to spread from person to person, They explained this through theories about shared exposure to corrupted air rather than direct transmission of infectious agents. This led to quarantine measures that were sometimes helpful by accident but were often poorly designed and inconsistently applied. The religious response to plague intersected with medical treatment in ways that often increased rather than decreased mortality. Plague was widely interpreted as divine punishment for human sin, leading to religious practices that brought large groups of people together for prayer and penance. These gatherings provided ideal conditions for disease transmission, while consuming resources that might have been used for genuine public health measures. Medieval physicians also recommended spiritual treatments alongside their medical interventions, prescribing specific prayers, religious rituals, and moral reforms that were supposed to address the spiritual causes of plague. While these spiritual treatments were probably harmless in themselves, they diverted attention and resources from practical measures that might have reduced suffering and death. The geographical spread of plague provided a natural experiment in the effectiveness of different medical responses. Communities that relied heavily on university-trained physicians and sophisticated medical treatments often experienced higher mortality than those that lacked access to advanced medical care. This pattern was noticed by some contemporary observers, but was explained through theories about the superior wisdom of divine providence, rather than recognized as evidence that medical treatment was counterproductive. The social disruption caused by plague created additional challenges for medieval medical practice. As large numbers of physicians died from plague, often as a result of their close contact with infected patients during treatment procedures, medical care became increasingly scarce and expensive. The surviving physicians faced enormous demand for their services, while working under conditions that virtually guaranteed their own infection and death. Some medieval physicians recognized the futility of traditional treatments and abandoned their practices during plague outbreaks. Others modified their approaches, focusing on symptom relief rather than theoretical cure. But the medical establishment as a whole maintained confidence in traditional treatments throughout the plague years, explaining treatment failures through increasingly elaborate theoretical frameworks rather than questioning basic assumptions about disease and healing. The psychological impact of plague on medical practitioners reveals another dimension of medieval medicine's failure. Physicians who had built their careers on confident application of medical theory suddenly found themselves helpless in the face of a disease that killed regardless of treatment. Some responded by becoming more aggressive in their interventions, assuming that stronger treatments were needed for stronger diseases. Others became paralyzed by uncertainty, unable to act when their theoretical framework provided no clear guidance. The aftermath of the Black Death created opportunities for medical reform that were largely wasted. The obvious failure of traditional treatments might have led to systematic reconsideration of medical theory and practice. Instead, the medical establishment generally interpreted plague as an exceptional disease that lay outside the normal framework of medical practice, rather than as evidence that the framework itself was flawed. Post-plague medical texts continued to recommend the same bloodletting, purging, and pharmaceutical treatments that had proved ineffective during the pandemic. The theoretical structure of medieval medicine proved more durable than the patients it was supposed to help, surviving the greatest medical crisis of the medieval period with its authority largely intact. The Black Death's impact on medieval demographics created a natural experiment in the relationship between medical care and population health. Regions that lost large numbers of physicians during the plague often experienced faster population recovery than areas where medical practice continued unchanged. This suggests that the absence of medical intervention was often preferable to the presence of medieval medical care, though this observation wasn't incorporated into medical thinking at the time. The plague experience also revealed the class-based nature of medieval medical harm. Wealthy patients, who could afford the most advanced medical treatments, often died at higher rates than poor patients who received little or no medical attention. This inverse relationship between medical expenditure and survival outcomes provides stark evidence of just how dangerous sophisticated medical intervention could be in the absence of accurate medical knowledge. The failure of medieval medicine during the Black Death serves as perhaps the most dramatic example of how theoretical sophistication can mask practical incompetence. The physicians who treated plague patients weren't ignorant or malicious. They were highly educated professionals applying the best medical knowledge available to them. Their failure lay not in their intentions or their intelligence, but in the fundamental inadequacy of the medical system within which they operated. As we reach the end of our journey through medieval medicine's catalog of horrors, a haunting question emerges. How did intelligent, well-intentioned people create a system of healing that killed more patients than it saved? The answer reveals uncomfortable truths about the nature of knowledge, authority, and the dangerous seduction of certainty in the face of uncertainty. Medieval medicine wasn't a primitive system waiting to evolve into something better. It was a sophisticated, internally consistent, theoretical framework that happened to be wrong about almost everything important. The physicians we've encountered weren't cruel or incompetent by the standards of their time. They were learned scholars who had mastered complex bodies of knowledge, dedicated healers who genuinely wanted to help their patients, and respected professionals who commanded the highest fees and greatest social status available to medical practitioners. Their tragedy, and their patients' tragedy, was that they were trapped within a system of knowledge that was both impressively elaborate and lethally incorrect. The theory of the four humors provided elegant explanations for disease and sophisticated rationales for treatment. The practice of uroscopy offered detailed diagnostic procedures that seemed to reveal hidden truths about patients' conditions. The art of bloodletting provided precise, measurable interventions that could be carefully calibrated to individual circumstances. All of these practices were logical extensions of accepted medical theory. All of them demonstrated the intellectual sophistication and scholarly dedication of their practitioners. And all of them killed patients who might have survived without any medical intervention at all. The numbers tell the story with brutal clarity. In medieval Europe, 1 child in 4 died before reaching their first birthday. 1 in 2 never saw their 10th year. Women faced a 9% chance of dying in childbirth. During plague years, professionally treated patients often died faster than those who received no medical care. The wealthy, who could afford the best medical treatment available, often experienced worse health outcomes than the poor, who couldn't afford professional medical intervention. These weren't accidents or exceptions. They were the predictable results of a medical system that had divorced itself from practical observation in favor of theoretical authority. Medieval physicians could see that their bloodletting patients often became weaker and sicker, that their pharmaceutical preparations frequently caused violent reactions, that their surgical procedures usually resulted in infection and death. But they interpreted these observations through the lens of established theory rather than recognizing them as evidence that their theories might be wrong. This created a system that was immune to evidence, protected from criticism by its own complexity and sophistication. When treatments failed, the failures were attributed to improper application of correct principles rather than to flawed principles themselves. When patients died, despite receiving the most advanced care available, their deaths were explained as resulting from conditions too severe for medical intervention rather than from medical intervention that made severe conditions worse. The economic and social structures surrounding medieval medicine reinforced these deadly patterns. The most expensive treatments were often the most harmful, creating financial incentives for practitioners to recommend elaborate and dangerous interventions. The most prestigious physicians were those who had mastered the most complex theoretical frameworks, regardless of their practical effectiveness. The medical education system rewarded theoretical sophistication over clinical observation, producing graduates who were more dangerous to patients than untrained individuals who relied on common sense. Perhaps most disturbing of all, medieval medicine's failures were often invisible to the people who might have reformed the system. Patients who died from medical treatment were rarely in a position to complain about their care. Families who lost loved ones to medical intervention often blamed the underlying disease rather than the treatment. The communities that suffered from ineffective medical practice had no alternative system to provide comparison and perspective. The transformation of medieval medicine into modern scientific medicine required more than just better tools or new discoveries. It required a fundamental shift in how medical knowledge was created, tested, and validated. Instead of relying on ancient authorities, modern medicine demands evidence from controlled studies. Instead of protecting theories from contradictory observations, modern medicine changes theories to accommodate new evidence. Instead of measuring success by adherence to established principles, modern medicine measures success by patient outcomes. Yet the medieval experience offers sobering lessons for contemporary medicine and contemporary society. The medieval physicians who prescribed ground skull for epilepsy and fermented urine for infections weren't fundamentally different from modern professionals who must make life and death decisions based on incomplete information. The medieval medical establishment that protected its authority through theoretical complexity bears uncomfortable resemblances to modern institutions that resist change and criticism. The confidence with which medieval physicians applied lethal treatments serves as a warning about the dangers of certainty in the absence of genuine knowledge. The elaborate theoretical frameworks that justified medieval medical practice demonstrate how sophisticated reasoning can lead to catastrophic conclusions when built on false premises. The persistence of harmful practices throughout the medieval period illustrates how professional interests and institutional inertia can preserve systems that cause more harm than good. But perhaps the most important lesson from medieval medicine is the recognition that good intentions and impressive qualifications are not sufficient to guarantee beneficial outcomes. The medieval physicians who killed their patients with kindness were not monsters. They were the prisoners of their own expertise, victims of educational systems that had taught them to value authority over evidence, consistency over effectiveness, and theoretical elegance over practical results. Modern medicine has largely avoided medieval medicine's specific mistakes, but the fundamental challenge remains the same. How do we distinguish between knowledge that works and knowledge that merely sounds convincing? How do we create systems that can recognize and correct their own errors? How do we balance the confidence necessary for effective action with the humility necessary for continued learning? The medieval experience suggests that these questions have no permanent answers. Each generation of healers must find new ways to test their assumptions, challenge their authorities, and measure their success by the welfare of those they serve rather than by the elegance of their theories or the sophistication of their methods. Today, when you take an antibiotic for an infection, receive anesthesia for surgery, or benefit from any of the countless medical interventions that modern healthcare provides safely and effectively, remember the medieval patients who suffered and died because their healers were trapped within systems of knowledge that were both sophisticated and wrong. Their tragedy reminds us that the most dangerous enemy of effective medicine isn't ignorance, it's the confident application of knowledge that feels complete but is actually fundamentally flawed. The terrifying reality of medieval medicine wasn't that people didn't know how to heal it, was that they thought they did. The physicians who prescribed ground unicorn horn and performed surgery without anesthesia weren't acting from malice or stupidity. They were acting from the best knowledge available to them, knowledge that happened to be lethally inadequate for the challenges they faced. In the end, medieval medicine serves as both a cautionary tale and a source of gratitude. It reminds us how dangerous healing can become when authority replaces evidence, when tradition substitutes for observation, and when theoretical sophistication masks practical incompetence. But it also reminds us how far we've come, how much we've learned, and how much we owe to the gradual development of medical practices that actually work. The next time you visit a doctor, receive effective treatment, or simply take for granted the medical safety that surrounds modern life, spare a thought for the medieval patients who died because their healers were too educated, too confident, and too sophisticated for their own good or for their patients' survival. The most chilling lesson of medieval medicine may be this: intelligence, education, and good intentions are not enough. Without accurate knowledge, rigorous testing, and the courage to abandon cherished theories when they prove inadequate, even the most sophisticated medical systems can become elaborate engines of suffering and death. Medieval medicine died slowly, killed not by sudden revelation but by the gradual accumulation of evidence that its fundamental assumptions were wrong. Its death created space for the birth of modern scientific medicine, based not on ancient authority but on contemporary evidence, not on theoretical elegance but on practical effectiveness, not on professional confidence but on measurable results. The physicians who finally abandoned bloodletting, rejected uroscopy, and developed truly effective medical treatments weren't smarter or more virtuous than their medieval predecessors. They were simply lucky enough to work within systems that valued evidence over authority, observation over tradition, and patient welfare over theoretical consistency. That luck, if we can call it luck, required centuries to develop and remains fragile even today. The terrifying reality of medieval medicine reminds us that the march toward better healthcare isn't inevitable, that sophisticated knowledge can be wrong, and that the most dangerous medical errors are often committed by the most confident practitioners. In remembering medieval medicine's failures, we honor both its victims and its lessons, ensuring that future generations of healers will continue to question, test, and improve upon the medical knowledge they inherit, no matter how complete or convincing it might seem.